Hello, my name is Everett Irish. I am a graduate level student at the University of New England in Maine. The topic of discussion today is infant mortality in Louisiana, and I am adopting the role of the public health nurse. So let's look at our problem statement. A lack of education or poor education, non-availability of prophylaxis, young and single-parent households, teenage pregnancies, a lack of access to healthcare and proper insurance, and a lack of consistent healthcare have contributed immensely to preterm births within the state of Louisiana. Therefore, impoverished young women of childbearing age in the state of Louisiana are ill-equipped socially and financially to endure the many challenges faced during pregnancy. So we might be asking ourselves, what are the factors surrounding this issue? What is the issue? What's causing the state of Louisiana to have such a high incidence and prevalence of premature births? First off, we'll say that 15% of Louisiana babies are born before term. That is before 40 weeks of gestation. Babies within Louisiana, at least 15% of them, are born at 37 weeks or prior to 37 weeks of gestation. The state of Louisiana has been one of 3 states that has been given a grade F from the March of Dimes due to its high incidence and prevalence of premature births. Now, with premature births comes many risks and complications, including pulmonary issues, autism, and cerebral palsy. The list goes on and on. However, these are 3 of the main issues found with premature births. We've also found that substance abusers, young mothers, teenage mothers, young mothers who use tobacco have higher risks or are at higher risk for having such complications. Now, a lack of education, poor education, non-availability of prophylaxis, low-income, young and single-parent households, teenage pregnancies, and the list goes on and on. All of these have contributed immensely to the high incidence of prematurity within the state of Louisiana. That being said, not enough is being done by policymakers, by the government, towards alleviating some of these issues found within these areas. Now, utilizing the socio-ecological model towards maternal child health issues, there are several different areas that we can use to intervene and attack the issue of premature births within the state of Louisiana. Now, the levels of intervention I'm referring to are the individual level, the interpersonal level, the organizational level, the community level, and policy level. Now, at an individual level, we see the dissemination of evidence-based literature and teaching, and this can come from either the public health nurse, it can come from the school nurse, it can come from many different areas. However, the key here is to advise the young mother and allow them to be cognizant of the fact that tobacco and legal drugs are dangerous during pregnancy. Now, some opposing factors of this that hinder an understanding on behalf of the young mothers is a lack of knowledge regarding the dangers of tobacco and illegal drug use. And this gap is the nexus between the dangers and the consequences. This is a gap that's bridged by the public health nurse. The main goal of the public health nurse is to increase realize the dangers that are associated with tobacco use and substance abuse. At the interpersonal level, we see incorporating the assistance of family, friends, social networks to help increase the knowledge of young mothers. At the organizational level, social structures such as schools or other institutions or other like institutions that offer education, sex education, with an emphasis on sexuality and sexually transmitted diseases are often quite helpful in disseminating such information. Sometimes, however, a lack of transportation from the individual's home to such institutions kind of hampers the ability of these networks to transmit such valuable information. At the community level, churches and other religious institutions are quite helpful in alleviating the problems associated with premature births. One factor that opposes this idea, however, are religious institutions that denounce birth control measures in Planned Parenthood. At the policy level, we can see nationally, state and federal agencies, policymakers helping to promote legislature that changes, that allow changes in the school curriculum regarding teaching of sex education. Now, the goal of the aforementioned interventions is to ensure that teenagers and young mothers curtail the use of illegal substances and tobacco. And this goal is geared towards alleviating the problems of premature births and all of the risk and complications that are associated with premature births. To that end, these goals are geared towards decreasing the number of children that are born to teenage mothers and young mothers with birth defects, thereby increasing the life expectancy of children born in the state of Louisiana. Now, after implementing the aforementioned interventions, we are charged with the responsibility of performing an evaluation. Now, we might ask ourselves, how do we go about performing such an evaluation? Well, the answer is simple. Firstly, we want to collect baseline data, and what we want to do is use that baseline data to help evaluate our method of intervention and associate that with current research. We can utilize the services of the public health nurse and the school nurse to assist in the dissemination and collection of surveys and assist with the examination of data. We can also utilize the results of youth risk behavior surveys, case studies, emergency room visits, and the collection of data from health departments and health clinics to determine whether or not there has been any changes in the incidence and prevalence of premature births. Now, of course, there would be a timeline for such an evaluation. This brings us to some of the challenges, the inherent challenges that we face as public health nurses. Some of these challenges are brought about by the lack of knowledge on behalf of both parents and their young teenage children. Lack of knowledge regarding the dangers of substance abuse and the dangers of tobacco use during pregnancy. Some young and teenage mothers may not consider the dangers of tobacco use or substance abuse and the effects it has on their unborn children. Additional challenges we face as public health nurses are lack of social support on behalf of single parents or absent parents or abandonment after parents learn that their young teenagers are now pregnant. As a result of this, some young mothers are left without the social infrastructure needed to bring forward a healthy child. Some challenges stem from inadequate financial resources and or transportation for remote areas. Some young mothers may have the necessary knowledge to have regular prenatal visits or to have consultation with their healthcare providers. However, because of the places in which they live, they are incapable of keeping these visits. On the opposite side of the spectrum, there are religious institutions or organizations who denounce sexual education in schools. And as a result, some schools may be somewhat reluctant to include in their curriculum topics such as sexuality or sex education on the whole. Additionally, there might be opposition on behalf of parents who believe that teachings about sexuality and sex education should come from the household and not from within the school. The public health nurse is faced with the challenge of bridging that gap and actually educating ignorant parents and teenagers regarding issues such as unprotected sexual intercourse, issues such as substance abuse, tobacco use, the necessity for regular health visits with health providers, and the importance of obtaining certain medications during their pregnancy. So just a quick look at our logic model. So under inputs, for the first one we have public health nurses, input from school nurses, teachers, policymakers, and private industry. For activities, any activities which would encourage the spread of information regarding prenatal care, the importance of medication, such as folic acid, vitamin B6, etc., and the importance of healthcare services and regular visits to healthcare providers. As a result of these activities, we have increased awareness related to the availability of prenatal care and new access to healthcare services. And of course, the outcome is a reduction in infant mortality, which is due to frequent health visits and the reliance upon proper nutrition. Secondly, we have inputs from industries such as health departments, the local health departments, Planned Parenthood, and sponsorship from local businesses. Under activities, any activity that would utilize skill to foster maternal-child relationships between mother and newborn. As a result of this, we have greater accessibility to services such as Planned Parenthood and access to services such as immunizations and continuity of care for both mother and young child. As a result of this, we would see an increase in doctors' visits and an increase in herd immunity due to the reliance on vaccinations. The next 6 activities, outputs, and outcomes are divided within the next input. So within input, we have behavioral health staff, input from rehabilitation services and mentoring services, which are supportive in implementing services and nutritional support. So under activities, we have any activity that provides services for victims of substance abuse and any activities related to involvement of teachers and school nurses. We therefore have increased opportunities for seeking counsel regarding substance abuse services, and we also have the availability of the school nurse who assists in teaching the importance of abstinence. And the output of all this, we see that teenagers are now able to verbalize and demonstrate an understanding of the effects of substance abuse. And we also see an alteration of coping mechanisms on behalf of teenagers and young mothers. Additionally, risky behavior is therefore reduced, and students now understand the rationale for abstaining from unprotected sexual intercourse. So what's the anticipated impact